Hello, everybody. I'm Dr. Rustamova, and I have with me Dr. Grija, Catalina Grija, my colleague. And today we're going to be talking about very, very interesting topics that a lot of people are interested, ask questions, but not that much of actual information that coming from MDs. A lot of information is coming from influencers, which I have no problems with that. But let's just see what real MDs think about certain situations. Dr. Grija, back to you.
Absolutely. Thank you so much for having me. It's such a pleasure to talk with you, and because I know definitely we are on the same wavelength, and we're both passionate about going to the root of the problems and fixing stuff, not just controlling things. And we both come from traditional medicine, and both of us have very interesting journeys. Would you
Yes.
like to share?
Let's start with you first.
Okay.
What made you go into that field? You are just a regular MD, you are seeing patients, you take insurance, and then one day you woke up and you decided to become a holistic doctor. What happened?
Yes.
Mhm.
So yes, I was seeing patients in private practice for 20 some years, and I was burnt out. I was
Mhm.
exhausted, and I was frustrated. It was too much of a bureaucracy and too little, um, too too few successes in terms of really fixing the problems for patients. It was my passion. It's always been to for weight management, for metabolic conditions, get rid of diabetes, lose the weight, be healthy. Yeah, so it's been a very interesting journey. After 20 some years of practicing internal medicine, private practice, and very, very busy, I got burnt out. And I was frustrated also. I was working so hard. And it's always been my passion to cure metabolic diseases, to try to get rid of diabetes and high cholesterol, and to help people lose weight. And it was definitely part of it, of course, people's mentality that I need a medication. And that's how we've all been trained, right? We need a medication to lose weight. We need a medication to just control the diabetes. We need medications for everything, or if that doesn't work, surgery. And I remember we were introduced to these supplements, and we started taking them. And my husband has high blood pressure. He's had high blood pressure since the age of 35. And within 2 weeks, his blood pressure dropped so drastically, like 102 systolic blood pressure, that I had to cut on one of his medications completely off. And at the beginning, I didn't realize what was happening because, again, I had never experienced anything like this with any natural product. But then when I realized that it was actually one of the products that was doing this, that opened my eyes to the possibility. And I started, researching and looking into more about natural products. And I discovered functional medicine, and I took the course, and the rest is history. And of course, I love still to help people lose weight, because I know that a healthy weight means health. And once people change in their habits and become healthy, the weight will go down, because our body's smart. We just have to give it the right tools. So yeah, that's my journey. So how about you?
How old were you when you had that revelation?
Wow. So with the supplements, that was 2018, and I took a leap of faith and transitioned to functional medicine in 2020.
Oh, okay. Very
Yeah.
interesting.
So this is only 5 years ago. I was 55. So it's never too late.
So with me, it was much early in my life because thanks to my genes, as I thought, once you have those genes, that's your destiny, and that you're destined to have a problem. That's what I thought.
Mm-hmm.
And mind over matter, once you think that way, it happens. In my 30s, I started experiencing what today we call metabolic syndrome. but I didn't understand.
Mm,
In my 20s, I had PCOS. I was fortunate enough
mm,
to marry early and have kids. So I didn't experience PCOS in a severe form. But I'm talking about the reproductive severe form when you have
mm,
infertility. I was fortunate enough, but unfortunately, I did not have understanding of PCOS and how it transforms and evolves into metabolic syndrome. At that moment, being a doctor, reading about this and understanding from typical medical, point of view was not enough. It wasn't enough. So that's why, and because of that, I had these. First of all, I had major gain weight. Okay, someone who was 110, 115 pounds all of a sudden started going up. During my pregnancies, I had diabetes. But meanwhile, you finishing your medical school, you doing your residency, you busy, you don't think about it. It's a marathon. You know
mhm,
that. You in the trenches, you have
yeah.
to be a doctor, you don't cry, you just get up, you do it. So you forget about everything and you just push, 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 push. That type A personality that you have to push, you have to do it. And being in residency, BGYN, it's like a military. It's being in the war zone for 4 years. So that's how it felt. And basically putting your health in the back burner, basically not putting yourself first. You see, that's a lot of mistakes I made in order for me to realize, to get to this realization. Yeah. Yeah, after gaining weight. Also, before that, I was a marathon runner. I used to love very long distances. So now I started developing autoimmunity. The
Mm.
first autoimmunity represented in form of angioedema. They call it idiopathic angioedema, which is you swell up, you itch, you cover in red rashes, big red welts, throughout the whole body. And but you don't know the reason. You do allergy tests, nothing shows that you're allergic to. Traditional allergy tests. At the time, the food sensitivity wasn't the same food sensitivity that we do today. So the answer was like, nothing is wrong with you. And being in New York City, being seen by doctors from Cornell and NYU and Mount Sinai and da 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 da, all these stellar doctors, the answer was idiopathic. That means we have no idea what's going
No
on with
idea.
you. That's what idiopathic means. Okay. Idiopathic angioedema. Meanwhile, it's not just itching and swelling on the skin, which it was autoimmune, as I understood now. It's not only swelling your lips, which is not only unsightly but painful, but it's also swelling your throat. At some point, I had that swelling of the throat that I almost had to be
Mm.
intubated. Okay. So that's how severe it gotten. And I had to be put on medication. So being on medication for a long time, first it was hydroxyzine, which is allergy medication, but makes you drowsy. So imagine being on drowsy medication, going through residency. I have no idea how I did that, but I did it. But then being on that for a long time, it created arrhythmias. I created arrhythmia and they had to take me off. And the only option was that working for me at the time, steroids. So I had to be on prednisone. Now we're on
Oh,
prednisone. Okay. So on top of that uh, problem that I have today, I have now metabolic syndrome, angioedema. I have, you know, all these autoimmunities that we don't understand what is coming from. On top of that, now I'm developing Cushingoid. Okay, literally covered in acne, the hair all over me, the weight. Became almost 200 pounds. I know it's hard to believe, but
wow. Yeah.
that's that's what happened to me. And besides that, something happened with my knees. My arthritis turned into osteoarthritis, bone on bone. So basically, I became bedridden in a wheelchair at the age of 38. So I
Wow.
was literally pinned to the wall and say, what are you going to do with this? And today's medicine, being in New York and having all the resources, I couldn't find answers. And this is when I started going into alternative world, searching, checking. And this is when I came across with stem cells. This is what I came across with metabolic disorder from alternative, from holistic standpoint. This is when I started connecting mind and gut, mind and body, how important it is. So this is when it all started falling into places. But again, being a doctor, and also, I teach at Mount Sinai, so I'm a serious doctor. I couldn't even talk about my holistic thing. So I had to hide for some time that I'm doing it.
Wow.
It was embarrassing for me to do that. I had to hide. So, but once in a while, I would just say it with residents, and they were just laughing at me at the time. We're talking 2016, 2015. Here comes
Hmm.
our naturalist. They used to call me naturalist because I would just talk about how to take dandelion leaves and how to good the fasting and how good this and how good that. They were, oh, this is how a naturalist. I was talking about vitamin D at the time. So people didn't take me seriously. And then the more I practice, the more I started noticing that it does make sense and it works. If I pulled myself from that rut where I was with all these natural things without medication, it must be something there. So I started truly believing it myself. And slowly, slowly, I started coming out of the closet, so to speak. And I started giving little advices to my patients. Maybe you should start taking potassium. Maybe you should start taking not potassium, but something that has potassium. Maybe you should start taking magnesium. Maybe you should start doing this. And then they come back to me and go, I feel so much better after taking magnesium. Thank you. So
Yeah.
this is how it's all started little by little. And then patients started coming back to me. My primary care doctor told me that I have to be on cholesterol medication. I know you have answers for me. What do you think? And this is when I started giving them advices. They started getting results. And I started feeling more comfortable in the skin of holistic doctors. So I did not have guts like you have a leap. Okay. My ripening was happening over time. That's what happened to me. But what happened is one thing drastically changed is COVID. Okay. During
Mm,
COVID, patients' awareness
yeah.
with other alternative treatments grew exponentially because
Yeah.
people started looking for, everybody started looking, the whole humanity was looking for alternative treatments, right? Boosting your immune system and so forth. And our colleagues, my colleagues would text me, say, hey, Rustamova, did you see that latest study about vitamin D? What it does? Da, 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 da. Oh, of course, you know?
Yeah.
So and then vitamin D became a part of the protocol that we use for pregnant patients. When patients come in, during COVID, regardless of her levels, we put her on 50,000 units of vitamin D. It became a part of the protocol at Mount Sinai.
Yeah.
This is when I became completely open. Well, I was already open, but I was ridiculed before that.
Hmm.
After
Hmm.
COVID, people were like, whoa, something is there. And they started, my colleagues, my doctors colleagues, they started listening to me, and now whatever Rastamova says, they believe. So I'm an authority now, but it took me good 15 years to get to that point. So that's my story.
Wow. Yeah, that's powerful. It's definitely amazing to fix yourself, right? And I think for people to doubt that you would do something that's not amazing for yourself, it's not acceptable, right? Because we don't want to harm ourselves. And of course, if we try something different, um, all of these things have been there. It's just that people were not paying attention to them.
Yeah.
And everybody was laughing at grandma's old remedy or things that were natural. And it's true. And now it's like you were avant-garde.
Avant-garde, but still very, I would say, anxious avant-garde and not outgoing in the beginning. Yeah.
Yeah, but it's been very rewarding,
It
right?
is. It is rewarding. It is. It's empowering. It's
Yeah,
empowering. Yes.
absolutely. So many people have these aha moments, and they finally fix their health problems, and they have answers for questions that they have been asking for years in traditional medicine. And your labs are fine, right? You're fine. There's nothing I can
Yeah.
do for you. Yeah, just take a pill. Yeah.
Yeah.